welcome to Taarika Foundation's YouTube channel, Supporting the Whole Child. We just wanted to give you a quick disclaimer saying that everything that is found on our YouTube channel is created for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something that you have heard or seen on this YouTube channel. Thank you so much, and without further ado, let's begin today's video.
Hello everyone, welcome back to the Taarika Foundation YouTube channel, Supporting the Whole Child. I am your host Poonam, and I do have Dr. Leena with me today. If you remember, we were talking about depression and various treatments of depression. So today, Dr. Leena is going to talk to us regarding psychotherapy or various therapies which can be utilized to treat depression. Dr. Leena, take it away.
Thank you, Poonam. Welcome back, everyone. So we are covering our series on depression, understanding what are causes and treatments of depression. So today we will focus on the psychotherapy aspect of treatment for depression. So if you've been watching our previous episodes, we've covered what is clinical depression, what are the causes, and what are the different types of treatments. And we had talked about biopsychosocial intervention model for treatment of depression last time. And so today we are focusing on the psychological intervention domain for treatment of depression, and under which comes psychotherapy. And there are different kinds of psychotherapies. And the one that is mostly used and is what we call as most evidence-based therapy is called as cognitive behavioral therapy. And the acronym that we use is called CBT, so cognitive behavioral therapy. So what is CBT? I'm sure you guys must have heard about this term, and maybe some of you know about it, but I'm going to try and educate some of you who don't know about it and make it really simple to understand and help you understand how this works. So CBT, like I said, stands for cognitive behavioral therapy. Cognition or cognitive is just a fancy scientific term for thoughts or the way we think or our thinking pattern, essentially. Behavioral, as the word says, is how we behave, so our behavior. And so the basic concept around this therapy is this understanding that the way we think affects the way we feel, and the way we feel affects the way we behave. So I'll give you my favorite example to help you guys understand what I'm trying to say. So situation is mom is running late from work, and there are two kids in two different households waiting for their mom to come home. Generally, she comes home at 6 o'clock in the evening. It has been 6:30, and she has not arrived yet. Usually she's pretty good about notifying the kids if she's running late. And she hasn't done that today. And so let's see how this is impacting the two kids. So the kid number one in the first household thinks, what if mom met with an accident? So imagine if you're thinking this way, how would you feel? So, if I'm thinking, what if my mom had an accident? Of course, I'm scared, I'm worried. So those are the feelings being generated by that thought. So I'm scared, I'm worried, I'm, feeling like, oh my gosh, what has happened? And the behavior that translates then for this child is that he starts pacing in the hallway, trying to call mom, dad, and find out what's happening. Same situation in the other household. The other kid actually chooses to think or thinks that, oh, mom must have stopped to pick my favorite dessert today that I have been asking for a few days. And by thinking that way, he's excited. He's like, yeah, mom had said she would stop one of these days. Maybe she got too busy to let me know that she'll be doing that, or she's doing that. That's why she's running late. And the behavior that translates for this child is that he's relaxed, sitting on the couch, watching TV, waiting for mom to come. So situation is the same. Mom is running late from work. There are two different kids who have two different, ways of thinking, and it translates a change in how they are behaving. So that's what is the construct for CBT. So this is being researched and understood over and again that our behavior is driven by our thoughts and our feelings. And by changing the way we think, we can change the way we feel, and that in turn will change how we want our behavior to be. So that's the first kind of foundation to understand what CBT is all about.
Dr. Leena, thank you so much for making it simple. And when you were saying that, a thought was coming to my mind. Since childhood, we have learned as you think, so you become. So definitely our personality and everything around us, like what we think, that's how we feel, and then that's how our attitude and personality becomes. So what are the various causes? I mean, one child is thinking good and other child is not thinking so good. So how, thoughts are coming into origin? Any insights on that?
So, we are trying to do more research to understand this. The kind of a couple ways to understand this so far we have come to is often, this may be a pattern that may be seen by the child in their family. So they may see their parents often think about more of like, look, the negative first, and then, think through like, oh, what else could be the reason. So a lot of us are probably born with this tendency to look at half glass empty versus full. And, from like the research, we understand that we may have that temperament, what we call as a little bit of an anxious temperament, where we are always thinking about what worse could happen, given a situation. And if it's been seen a lot in the family, and if the child is seeing, that's one of the ways we always like think about things, then that can certainly shape their thinking as well. There might be biological basis to this. Is one understanding we have is that you may, have some, that biochemical predisposition to have a little bit of that negative thinking. And so, as we are understanding more that even though we have maybe some predisposition like that, you may be born with this tendency to look at, oh, what could go wrong, then what could go right. The power of our thoughts is such that we can actually try to work on changing them. So it's definitely understood that we can reprogram the software that is if we have a certain way of thinking, we can reprogram this and try to work on making it change from or go from negative to maybe at least neutral, if not positive. And cognitive behavioral therapy really helps us do that, and that's why it's actually so popular and it's such a successful treatment.
That's really good to know, Dr. Leena. And another thing was coming in mind. What if child did watch some movie or did read about a news like where accident happened, and maybe that correlation was also happening? So because sometimes we think because there is an external stimulus or environment we are in. But great to know, like we can reprogram ourselves. So I think you are going to educate us how do we do this reprogramming and how CBT and what are the various methods of applying the CBT therapy techniques and what are the benefits. So anything you would like to share more about CBT?
Yes, absolutely. So we have learned a lot of different techniques or strategies to kind of reprogram this software of our thinking. And so the first, I guess, way we look at doing this is to really understand what am I thinking? Is that a right way of thinking? So in other words, if I am having a particular thought like, what if mom met with an accident? Is that a valid thought for me to have, for me to believe in? So, I mean, it's totally valid to kind of have that thought. So that's not a question. But is it really true, or is it something I need to believe in? So there is this technique of CBT called as detective thinking, where you become detectives of your thought. So just like how we see detectives do a lot of investigation to figure out who's the person who committed the crime, and they look for evidence. They look for some kind of proof to prove that this person is guilty because we found this particular fingerprint on this, or whatever they kind of go about doing investigation in the crime. The same way here, we are going to be detectives of our thoughts and say, why do I believe in this? What's the evidence for me to believe in this thought, and what's the evidence that goes against that this thought is likely true? So we encourage kids to really make two columns, and under one category, you look for what's the evidence that supports this thought. So, it may be like, oh yeah, I've been watching a lot in the news these days. There are more motor vehicular accidents happening, or the weather conditions have been bad, and that's why my, mom might have encountered some problem with her driving and met with an accident. So whatever that is, because there might be real reasons, right, that you may feel like, yeah, this is a likely thing that could happen. But then, when you start looking at the other column of evidence against, you may find even more logical, rational reasons for why this may not be really true. So, I'm not saying that you may not find reasons to support your thought. Like, obviously, there are certain reasons why we start believing in a particular thought. So you will list this under the evidence for column. And then under evidence against, what we invariably find when you sit down and do this exercise, and I would encourage you to and experiment with this, that the list of things that go against, the evidence tend to be generally longer. So it's not like, there will be, more. So the idea is to understand that, yes, there is a likely probability that this is something that may happen to my mom, but really let's look at how likely this is. What's the probability, and what else could be the reason that could be going on before I jump to conclusion that this is what's gone. This is what's got happened, and that's what I need to get worried about. So it's a very easy, simple technique that one can do. So when you are feeling like there are certain thoughts that scare you or generate any negative feelings, this could be applied for a lot of those types of thoughts. The other thing that we also talk about in terms of strategies to challenge your negative thoughts is to look at what kind of distorted pattern of thinking is hidden in your thought. So research has shown that there are different kinds of distorted patterns of thinking, or we also use terms like thinking traps that we all have. Like, we get into these thinking traps that are commonly seen in all of us. Like, I do it, you do it. So it's not like unique to only some people. But certainly, it is seen a bit more with people who have that anxious temperament or have some family history of anxiety, depression. So they are a little bit more likely to spend more time in that type of thinking. But we all do it. And certainly when somebody gets clinically depressed, there is a lot more frequency and intensity of this type of thinking that happens. which is why, they get distressed. So, one thing we do is to actually go over these different types of cognitive distortions with our clients and tell them, oh, what was the reason you stopped talking to this friend? He thinks I'm a loser. That's why I feel like, he doesn't value me, so I've stopped talking to this friend. So, okay, so has he ever said that to you? Has there been any indication in his behavior or any comments or anything that makes you think this way? No. Why do you think? I just think he thinks I am a loser. So, let's talk about it. This particular thinking of yours or this thought, he thinks I'm a loser, is actually indicating one of the common distorted patterns of thinking called as mind reading. So sometimes, we kind of assume that whatever my mind is telling me about this other person is true. Like we do what we call as mind reading, and we believe that that's the right thing when there may not be evidence for that, or it might be more of your perception than the fact. So, first step I need to, often do is to actually figure out what's wrong with my way of thinking before I can correct it. So cognitive distortions and the education about cognitive distortions can really help the person to really say, oh, I'm doing mind reading now, or I'm doing discounting positives now, or I'm doing fortune telling. Sometimes we predict our future based on something very trivial in our present, or we just believe that's exactly what's going to happen. Like a classic, fortune telling thought I hear from kids is, oh, I got a B, that means, I'll never get a job and I'll be on the streets. Like, they can go, and there are multiple distortions here. There is this fortune telling based on just one episode of like not doing well in school. And then there is catastrophic thinking, as we say, is another type of distortion where you go to the extreme negative end of what this could lead to. So a lot of the times, people are like, we don't realize that there are so many distorted patterns in our thinking that we are going with and we believe in. And we just, believe that that's what it is true. And that's what drives a lot of anxiety and sadness. And so by giving this education, it can be very kind of a big game changer for a lot of people to start pointing out, oh, I'm doing this. This is not the right way of thinking. And then I can challenge the thought using different strategies like, detective thinking. There are, other strategies as well, but that gives you a little flavor of what CBT is all about.
Absolutely, Dr. Leena. Very fascinating. I'm definitely going to use that detective thinking in my day-to-day thought process, and it was interesting to learn there are so many traps, thinking traps. You did explain some of those today, and I'm looking forward to learn more about the thinking traps as well as strategies to change your programming and reprogram and be happy and healthy person. Thank you so much for joining us today.
Thank you.